Many people are experiencing symptoms weeks and even months after they tested positive for COVID-19. While the World Health Organization estimates 80% of COVID-19 infections are mild, patients recover after 2 weeks. Those who are still suffering question that number. Our Meredith Aldous spoke to a local specialist to find out more about if or when those in distress may get some relief. Meredith.
Greg, I've been told it depends on the symptoms. Some can be treated quickly, while others may take a while. Doctors are still learning about this virus and trying to figure out better remedies if there are any.
My family's eating something and they're like, oh, this is so good. Initially, I was like, really? Like, it doesn't even have much flavor. And I think that's when I kind of realized, like, it's still just me.
Alexandra Kimmett says she was diagnosed with COVID-19 on Thanksgiving Day, lost her taste and smell about 4 days later, and they still haven't come back.
Put something directly under my nose. Sometimes I can get a hint of something.
Dr. Anderson, an infectious disease specialist, says there's not a remedy for it. Kimmett says this is worrisome for her and her family's safety.
There was a fire, or if you're burning your food, like, it could be a bad thing to not have your sense of smell.
Dr. Mark Anderson says the COVID-19 virus can affect your respiratory system, heart, and central nervous system. He says common symptoms that tend to linger are loss of smell and taste like Kimmett is experiencing, but there are many others like chronic cough, shortness of breath, severe fatigue, rashes, joint pain, blood clots, and decreased cognitive function.
It's provoked an over-response and a too vigorous response of the immune system, and the immune system itself actually does a lot of damage.
He says although most of the symptoms are seen in people over the age of 60, it's happening to people in their 30s as well.
Some of them that say they're associated with like scarring in the lungs, scarring in the heart muscle. We can't really fix that. We can give medicines that help. We can give oxygen for people with lung problems, but there are a lot of these things we're not going to be able to cure it or really make it go away.
If you've had the virus and experienced these symptoms, Dr. Anderson says it's important to follow up with your doctor and get chest x-rays because some of the problems are treatable.
I think our healthcare system is going to be dealing with this for years.
Dr. Anderson says this could be disturbing for those who may never get their sense back. Knowing that some of these symptoms may never go away, it underlines the reason to try to avoid the virus altogether. Wash your hands, social distance, and wear your mask. Reporting live in the studio, Meredith Aldous, Channel 3 Eyewitness News.